Hi, everyone, and welcome to the Cyber Podcast series. I'm Jaren Day, Director of Cybersecurity here at KLAS Research. And today we're digging into a question that's keeping a lot of healthcare leaders up at night. And it's really when identities can be faked at scale, how do you know who to trust and who and what is inside your health system? Joining me today is Bryan McDowell with a major healthcare organization in Cleveland. Go ahead, Bryan.
Yeah, thanks. It's great to be here and appreciate the opportunity. So my role is Chief Security Officer. I have cybersecurity as well as physical security, all of our police officers and police operations, and emergency management and environmental health and safety. So a lot of things we're going to talk about cover each of those three areas, and they kind of intertwine.
Yeah, absolutely. And this topic that we're talking about today with identity is really important right now because we've seen a lot of AI generated resumes. We're hearing, cloned voices, deep fakes, fake employees starting to really hit the recruiting piece and access management. But in healthcare, it's really not about like the hiring fraud. It's also about protecting like the patient data and the clinical systems. And so I'd love to kind of start with you, Bryan, as we look at this topic in particular. You know, you've seen these AI generated resumes and interview deep fakes. Like, from your experience, what are some of the telltale signs that something is off or something isn't real?
Yeah, I mean it's interesting, right? You think about healthcare space. The majority of people have to be on site. You can't remotely take someone's temperature or treat them in the room, right? So we're not talking about the nurses, we're not talking about the bedside and in the hospital. So I would say as much as possible, try and bring people in for in-person interviews to remove that need for having to worry about that. But on the resume side, everyone's using AI to try and polish up their resumes and try and make it look a little bit better and more attractive, make sure it's meeting the requirements. Some of the areas I would look for is inconsistencies in chronology or in formatting, right? These AI generated resumes often they look overly polished. They look too good. And that saying of it's too good to be true, it likely is. I mean, that's one word. The other one is overuse of buzzwords. We see that a lot. People make jokes about it. But resumes that have a ton of buzzwords like synergize, cross-functional teams, I've leveraged AI to improve workflows, that starts to raise suspicion, right? It doesn't feel real. It doesn't feel genuine. It doesn't feel like someone's actually writing that. It's too polished. On the voice, that's on the physical side. When we start talking about the videos, that gets really challenging on the video side because they can do deep fakes. So as much as possible, you try and have people, you look for the video quality, you look how fast they're responding, you make sure that they're on camera. And those are some of the ways that you can try and detect the deepfakes on the digital side. As I mentioned, if you can get them there in person, that's great. Now we'll have radiology be remote, radiology read be remote, or IT. We're still a little more, I wouldn't say national remote. We're still a little more geographically isolated to Northeast Ohio and within driving distance. So we try and have people come in particular for some of our sensitive areas or have admin access. You really have to come see us in person if we can.
Yeah. Yeah, you bring up a good point, and it really feels like AI is everywhere and it's hitting every part of our health system. And there is the response that like detecting some of these AI, using AI to fight AI is going to be a solution here. And so I'd love to understand from your perspective, how do you usually, or how should we be using AI responsibly in our security programs without introducing any sort of bias or false positives? What's working and, what still needs work in this space?
Yeah, what's interesting, I mean, depends on people's definition of AI, right? It can mean a lot of things or not. It's a newer concept, but not really, right? We've used machine learning, we've used behavioral analytics, right? It's a generative AI that we're talking about now that really causes challenges where, phishing emails look better. The amount of automation they can do is much easier. They don't have to be as much as a skilled programmer to automatically scan your environment and look for those vulnerabilities, where they can take masses of this data and collate it and pull out valuable information much quicker on you. So I mean, honestly, we try and stick to the basics. Yeah, they need a fair amount of access, right? In order to make the benefit that you want, or the benefit, the desired outcome for these things, they need to have access to a ton of stuff. So we still try and practice minimum necessary, but there's some key things you can do. One of which is identity classification. You're going to try and tag identities as human, machine, or some sort of hybrid. We've talked about where you can tie it to a person, someone owns it, right? But I would work on a identity classification. Another one is context aware access controls. So this falls into that user behavior analytics to look for those anomalies and when these things are happening. Like service accounts should always do these things, right? They're meant to turn this dial, flip this switch, and pull this lever. And if it starts to go outside of outside of those bounds from a behavioral analytics perspective, then that might set off some red flags that your team's going to want to go look at. Device attestation, certifying devices is another way you could do it. And then lastly, privilege account management is still a great tool for those types of things. When you need to perform these additional activities, you must make people elevate using two-factor authentication.
That's an interesting development that I think the expansion of technology just brings one more challenge to us. Yeah. Yeah. I think we've seen a lot of that, like system consolidation and consolidation of the tech stack. And so love to hear kind of your points there. And finally, we want to talk about, what's next? Like what are some practical next steps to kind of close here for any health system and how they can make this right and get ahead of AI and the identity curve here?
Yeah, there's always a ton of governance committees in any healthcare organization, but if we're looking some practical moves to help, capture that, establish an AI and identity governance council. So we actually have an AI council, and there's also a governing group that kind of shepherds that. So any new AI that's coming into our environment will actually have to go through the governance council. But there's a group of us, chief compliance officer, the CIO, myself, chief our VP of risk and insurance, we all sit on that council and we look to make sure that the things that are coming in, do they make sense and are they of value to be prioritized first? So I would say start with that governance council to make sure that you know what's coming and not. Policies would follow that, right? Create a governance policy or create an IA policy. You can even use AI to generate that policy because there's a ton of them out there already. Other practical things to work on, that identity I talked about earlier, you can do an identity threat detection. So again, that's back to user and entity behavior analytics. You can monitor both the human and machine behavior as a first step into trying to detect those things. Education is always important. We've worked on actually some education pieces to remind people what to look for. I just finished my annual compliance training and included in there how to spot AI and AI generated emails from phishing. So educate. And then lastly, I would pilot some AI tools for auditing tools. And so what they'll do is they'll look for content and access patterns to try and help you out in that space.
Yeah. Yeah, I think those are great words of advice. And thank you so much for joining me and sharing your perspective today. If you're listening and wondering about where you can learn more about cybersecurity and healthcare, feel free to join us at classresearch.com. I'm Jaren Day with Bryan McDowell. Thanks for tuning in to the Cyber Podcast series where we connect cybersecurity to the patient care. Have a great day. And don't forget to like and subscribe.